All right, so today I'm going to be talking about Medicare. I don't know about everyone else, but I know for me, before doing this, I definitely always got Medicare and Medicaid confused with each other. So I'm going to start off by talking about what Medicare is. So, Medicare is the federal health insurance program for people who are 65 years of age or older. Certain younger people with disabilities can also qualify for Medicare, and people with end stage renal disease, which is permanent kidney failure requiring dialysis or a transplant, sometimes called ERSD. So, by definition, Medicare is a health insurance program for the elderly, and Medicaid, on the other hand, is for low income individuals that need financial and/or healthcare assistance. Some background information and key info that I found was that Medicare was actually created in 1965 to provide health coverage for Americans aged 65 and older. The program was expanded in 1972 to cover younger Americans who have permanent disabilities. There are different parts of Medicare, and each part is funded differently, just depending on what it is. And like I said, the program is comprised of different parts. So there is Original Medicare, which has parts A and B. Medicare Advantage has part C, which usually covers everything. And then there's part D, which is prescription drug coverage, and there's Medigap. So, like I said, there are different types. So there's different kinds and different coverages just depending on what it is, and there's different parts that tell you what it covers. So there is a Medicare Part A, which is hospital insurance, which covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. And there's Medicare Part B, which is medical insurance. This is going to cover certain doctor services, outpatient care, medical supplies, and preventive services. Medicare Part C, also known as Medicare Advantage, has Part A and B. It just kind of covers everything, and it has additional benefits to it, such as vision, hearing, dental, and more. Medicare Part D is going to be optional prescription drug coverage. What this is going to do is it's going to add prescription drug coverage to Original Medicare, some Medicare cost plans, some Medicare private fee for service plans, and Medicare medical savings account plans. So, how to get started with Medicare? There are 3 steps you need to follow to help you get started. Just break it down and make it a little more simple. So, the first step is sign up for Medicare through Social Security. If you're over the age of 65 or turning 65 in the next 3 months and you're not already getting benefits from Social Security, you need to sign up to get Medicare Part A and B. Step 2, you're going to choose your coverage. So there's 2 main ways to get coverage. One is Original Medicare. This is going to include Part A and B. And then, like I said earlier, there's Medicare Advantage. What this is it's an all-in-one alternative to the original plan. And these bundled plans include Part A, B, and usually Part D. Most plans include extra benefits such as vision, hearing, dental, and more. And then step 3 is you're going to complete your year 1 Medicare checklist. You can find this on the website. What this is going to do is, just get you through everything to make sure you're getting all of the benefits that you can out of the Medicare and, everything that it covers. So some information that I found regarding Medicare was that in 2001, Congress actually added ALS as a diagnosis that makes an individual eligible for Medicare prior to the age of 65. Approximately 17% of the Medicare population, or 8 million people, are under the age of 65. More than 61 million Americans are currently covered by Medicare, and funding for the program accounted for 14% of federal spending in 2019. The government's net Medicare spending is expected to grow from $590 billion in 2017 to an estimated $1.2 trillion in 2027. Whoa. So some information regarding Medicare in Oklahoma specifically is that Oklahoma was actually one of the first states to insure Medigap plans for people under the age of 65. As of February 2019, nearly 723,000 Oklahoma residents are enrolled in Medicare, and only 18% of Oklahoma Medicare beneficiaries are enrolled in Medicare Advantage plans. The availability of Medicare Advantage plans in Oklahoma range from 2 plans to 27 plans, and this just depends on the county that you live in. So what I found was that in order to qualify for Medicaid in the state of Oklahoma, you must have an annual household income before taxes that is less than or equal to a certain amount that can be found on this website right there. There's like a little chart that just tells you what your annual household income has to be. Just what's the word I'm looking for? Just, and it depends on like your household size. Yes. So yeah, there's that. And then some Oklahoma resources that I found for Medicare beneficiaries. Medicare.gov has a list of resources for Oklahoma, specifically sources. You can check the State Health Insurance Assistance Program website, and the National Institute on Aging Information Center website. And there are also different websites that you can go to in order to learn more about how Medicare plans work in Oklahoma, including Medicare Advantage plans in Oklahoma, Medicare Supplement or Medigap plans in Oklahoma, and Medicare Part D plans in Oklahoma. So yeah, Medicare is pretty cool. It's pretty awesome. I think that a lot of people may or may not know about it. I know like I've heard about it, but I never really knew much about it. But after doing some research, I learned a lot. It's pretty cool. This last slide is just some references of the different websites that I went on to find all this information. But yeah, hopefully y'all learned a little bit more about Medicare today. And yeah, thanks for listening.